Hey guys, my name is Carson Alexander, and for my neurological condition project, I'm going to talk to you about CHIARI malformations. This video will give you an insight as to what CHIARI is, how you might get it, your different signs and symptoms that you may be having, treatment processes, and other aspects like that. And then at the end, I do have a Kahoot for you guys to play. You can play along with your little note cards and the video. But other than that, let's get started.
First, I'm going to explain what CHIARI malformation is, and it's a structural abnormality at the back of the brain and the skull, which normally you have a large hole at the base of your skull, which accommodates the connection between your brain and your spinal cord, and the connection point is surrounded by fluid that moves between your head and your spine. But if you have CHIARI, the back of your brain, which is the cerebellum, will actually be pushed down through the opening, which creates pressure on the spinal cord and restricts that fluid from moving. CHIARI is actually considered a congenital condition, and it was categorized based on its severity between types 1 through types 4. As for the diagnosis of CHIARI, there are several tests that can help diagnose and determine the extent of it, and those are the MRI, CT scan, and sleep study. And if you don't have symptoms, which is quite common, the problem may be found when you are having other imaging tests for other reasons. Although there are 4 different types of CHIARI, for this presentation I'm mainly going to be focusing on type 1, which the problem is presented at birth, but it may not be found until the person is a teenager or entering their young adult stage. There is a possibility of a syrinx, which is a pocket of spinal fluid in the spinal cord or the brainstem. This malformation also occurs during fetal development, and it's characterized by the downward placement of the cerebral tonsils into the cervical spinal canal. This displacement actually blocks the normal flow of the cerebrospinal fluid between the spinal canal and the intracranial space. The abnormalities of the base of the skull and spine are seen in 30 to 50% of the patients who have CHIARI, and these abnormalities can include things like compression at the upper part of the spine, bony unions of the first level of the spine, partial bony unions of the first and second levels of the spine, cervical spinal bifida, scoliosis, and many others are possible. So for a brief overview of the additional types of CHIARI, Type 2 is a malformation that is characterized by the downward displacement of the medulla, the fourth ventricle, and the cerebellum, as well as elongation of the pons in the fourth ventricle. For type 3, it's a malformation that includes a disclosure with the portion of the cerebellum and the brainstem that push out through the back of the head or the neck. These are very rare, and they are associated with a high early mortality rate. And type 4 is a malformation that is the most severe, and it is the rarest as well. It's when the cerebellum fails to develop normally, and most babies that are born with this malfunction do not survive. So there's not actually a well-known etiology of CHIARI, but there is a speculation of the posterior fossa being too small for CHIARI patients, which causes the cerebellum to grow outside of the skull. There was also a recent theory that CHIARI-type symptoms are actually due to cervical instability, and then some other established and less known causes could include a mass in the brain, like a tumor or a cyst, and those push out the cerebellum. Spina bifida could also lead to a pressure drop and herniation, or a rare genetic condition that actually severely affects the skull shape. The symptoms of CHIARI actually develop as a result of 3 pathophysiological consequences of the disordered anatomy, which include the compression of medulla and upper spinal cord, which results in myelinopathy and lower cranial nerve and nuclear dysfunction. Also, compression of the cerebellum, which results in ataxia, dysmetria, and disequilibrium. And then a disruption of the cerebrospinal fluid flow through the foramen magnum, which also accounts for the most common symptom, which is your pain. The prevalence of CHIARI is actually unknown because a lot of the cases go undiagnosed or are actually misdiagnosed, which makes it difficult to determine the frequency of this disorder. There are an estimated 1 in 1,000 people who have symptomatic Chiari, and there are over 10,000 Chiari surgeries each year. Although Chiari is not considered fatal, there are case reports of sudden death associated with it due to breathing problems and mortality, which is associated with the surgical complications. There are also studies that show Chiari patients are at a higher risk of self-harm behaviors and new cases of suicide each year. There is no single definitive test for symptomatic Chiari. For the related populations and lifespan considerations of Chiari, it affects all races and ethnicities, but within adults, women are affected more often than men. There's an even split within children. Symptoms can develop at any age, and although it's thought to be congenital, children and adults in their late 20s to early 30s are most common to experience symptoms. Other health problems that are caused by a Chiari malformation include long-term pain, a pocket of spinal fluid in the spinal cord or brainstem, lifelong damage to muscles or nerves, paralysis or not being able to move your arms and legs, and it is recommended to watch for these changes in your health to prevent these problems in the future. Although it is very common for Chiari patients to not experience any symptoms, if the symptoms appear, they will arrive between the ages of 10 and 20 years for the most part. So that is why if you are born with Chiari, most patients may not even know it until the later ages of their childhood. The most common symptoms for Chiari are severe headache and neck pain, but other symptoms can include loss of muscle strength, dizziness, balance problem, sleep apnea, difficulty swallowing, and even paralysis. For the medical management of Chiari, the only treatment that addresses underlying problems is surgery. Treatment decision is based on whether symptoms are clearly due to Chiari and bad enough to warrant surgery. There's no objective test or criteria to say when a patient should have surgery or shouldn't. Only about half of the patients that are evaluated are recommended for surgery, and the factors that can affect recovery are surgical complications, success of decompression, duration of symptoms, lifestyle, and mental attitude. Patients in the poor range of 10 to 20% may end up getting revisions or other surgeries. Over a very long term of 10 plus years, symptom reoccurrence has been reported. The goal of surgery is to make room around the cerebellum by removing part of the skull and the spine. Surgical treatment of the malformations depend on the type of malformation. Chiari 1 malformations can be treated surgically with only local decompression of the overlying bones, decompression of the bones and release of the dura, or decompression of the bone and dura and some degree of cerebral tissue resection. Occasionally, some patients will also require cervical spinal fusion. The outcomes include irreversible nerve damage and possible repeat surgeries if they are needed. Some of the precautions that these individuals need to become aware of include their mental health diminishing and limitations on their social interactions. Most individuals experience the inability to focus or concentrate on topics within their daily routines and school due to their severe headaches. Individuals also experience the limited ability to engage in physical activities. They experience loads of pain, weakness, and even fatigue. As symptoms worsen, it is hard for them to feel noticed when they aren't physical to outsiders. Individuals could feel neglected or avoided due to their inability to socialize the same as their peers. These feelings of being misunderstood can hurt their socializing in ways that make them consider not reaching out or feeling like they can get past their difficulties on their own. This is my list of references that I used.
Alright, for our game today, we have a Kahoot, and you guys can play along with my friends in the video if you want. You can hold up any of the shapes that you think the answer is on the cards that I handed out earlier, and good luck! Alright, that's all I have for you guys today. Thank you so much for listening and playing along with my presentation. I hope you guys enjoyed and at least learned something new about Chiari malformations.